All right, we're recording. All right, Miss Dancy, thank you so much for joining COVID Talks. It is so good to have you. How are you?
Hi, Adrian. Thank you so much for joining me. It is so good to have you for a second iteration of COVID Talks. How are you doing?
I'm fine. Thank you so much for having me. I'm glad to be here.
I'm good. How are you doing, Jordan?
Busy, but good. Happy to be safe.
Since this is your first time, I just want to go ahead and introduce you to COVID Talks. So, this is a channel dedicated to giving people a look at the COVID crisis, not through a political lens, but just from ordinary healthcare providers whose job is to keep us alive and safe. So thank you for helping contribute to that. Now, I do want to say this is about getting advice from medical professionals. This is about getting your experiences on your job. I realize I am not interviewing epidemiologists, so I'm not looking for you to give us specific advice telling us like how to in the pandemic. If there's something I ask and you don't know the answer to it, it's perfectly fine to just say you don't know. It's perfectly fine to say this is my opinion, this is what I think. We are not looking for to have all the answers, just looking for your advice from your experience helping us.
All right. I think I can do that.
All right, cool. Well, let's jump right into it then. So this is your first time. I'd love for you to introduce us to you and just let us know what your job is and how long you have been doing it.
So my job here at the health department is the assistant public health director. I've been in this role for about 2 years, but I've been at the health department almost 13 years. Been in healthcare as a nurse almost 17 years. Prior to coming to the health department, I was a labor and delivery nurse.
Wow. Okay. Awesome.
We know you've been on the show already, but can you just reiterate what your job is, how you do help people, and how long you have been doing your job?
Okay. What I am the director of retail pharmacy over at Carillion in Southwestern Virginia. We are a relatively small health system, but we're the largest in the area. So, and we're a community nonprofit hospital. So we largely service a very large underinsured and underserved population. We have 6 pharmacies spread out throughout the area. Some 2 of them are attached to a hospital. 4 of them are in outlying areas. And what I do is I manage day-to-day operations, make sure the pharmacies are compliant. And right now, increasingly, my job role is scheduling and preparing for large-scale COVID vaccinations.
Okay, good, good. That's a great segue because that's what we're going to get into. So the next question here is, how has COVID affected your job? Of course, now we're going to take this into vaccines.
So my job used to be protecting my staff from spreading and coming down with COVID.
Mm-hmm.
We had a very robust system of screens mixed with PPE and then suggested social distancing, depending on whether or not you had a suspected exposure, which really hurt our operations because, as you can see, you have you're never quite sure who's going to show up that day because you're trying to run your normal operations, and then 20 to 30% of your staff can't come in. So that was difficult this year. Now that we've got the vaccine, what my job is I'm assisting our employee health department in vaccinating the larger hospital staff.
So prior to COVID-19, typically what we would do, we do our regular typical public health functions. We have individuals coming in for family planning services, STI related services. My day would consist of strategic planning for the agency. How can we go out and do more community partnership? In my role is making those connections to individuals in the community, spreading the message about the wonderful work that we do at the health department, and kind of being a face for public health, advocating for staff, advocating for funding and grants. So that would typically be my role prior to COVID.
Okay.
My role after COVID, I had to go buy more scrubs because I can't wear my clothes clothes that I would normally wear because we're out in the field, we're doing vaccinations, we're testing, we're going and checking on people and doing contact tracing. So back to more of my fundamental nursing role in terms of being boots on the ground, helping out, as well as still keeping the administrative piece together. So we're receiving a lot of funding from the state and other individuals because we need the help and the funds to be able to provide this support to the community. So a completely different shift from what we normally do. Our hours of operation, when we ran a shelter for our homeless individuals who needed to isolate and quarantine, that was a 24/7 operation.
Wow. Wow. Okay. So I'm just going to go over a few statistics here. So according to ABC News, we've had more deaths in the first 11 days of January than all of August of 2019. Now, you were specifically involved with things like contact tracing. Evidently, we were allegedly significantly behind on testing, contact tracing, and now the vaccine. Early estimates suggested we would need 100,000 to 300,000 contact tracers, and well over 6 months into the pandemic, we have around 70,000. That is according to New York Magazine. Operation Warp Speed was, of course, supposed to get 20 million people vaccinated by the end of 2020. That ended up being only 2.8 million. And lack of federal guidance means states are left to figure things out for themselves, according to Reuters. And of course, you would have firsthand experience with this as well. According to Dr. Leanna Wen, former Baltimore Health Commissioner, it would take years to immunize enough people to end the pandemic at current rates. She says we need to be doing about 3.5 million a day, not 1 million a week. Of course, we are planning to get vaccines rolling out to people in arms faster now, but of course, it's been very, very slow so far, even though according to Business Insider, the US has had over a year to prepare, or about a year to prepare for the vaccine rollout. Now, despite all of these things, many people are worried about taking the vaccine. So if given the opportunity, would you take the vaccine today and why?
Well, I've already had my vaccine. So I had my vaccine on December 30th. Okay. Initially, I was very skeptical. I think in minority communities, we all are very skeptical. And me being from North Carolina in the Deep South, we have many reasons to be skeptical. And at first I was like, I'm not quite sure. I read everything. This is a very different vaccine that we're used to. So it's very new. So just the newness of it is, puts even some medical providers on pause of, is this really safe? What about this? It's something we've not done before. It's not like the flu shot. It's not like any other shot. But as I've done my own research and my own knowledge of the vaccine, and once we had the vaccine in-house and we're preparing it and mixing it and we're doing all those things and you get more comfortable with it, then, it changes that message for you. And so I received my vaccine. I've been fine. I'm waiting to get my second dose. And I tell people, I have a grandchild, not only for me, but for her, for the future of our country, we need to be vaccinated and we need to be doing our part in terms of making the community safe, because COVID doesn't just affect you. It affects anybody that you're in close contact with. And more than likely, that's going to be your family. So I have an elderly grandmother, I have parents, and I have a grandchild that I want to be mindful of and protect and be an example for. So they look to me for that piece. And if I don't do it, I know they won't. So,
earlier last year, I would have said, I'm not sure I'd like to see the data, but, we've spent billions of dollars on this vaccine. Tons of research that's gone into it. And from what I've read about the safety and efficacy and the trials that they've had, I have no problem administering the vaccine to people. And I would offer my arm in a moment. As a matter of fact, I got my vaccine a week and a half ago, my first dose.
Okay.
I'll be getting my second dose very soon.
Okay, cool. So very, very quickly, since we're running out of time here, let us know about that process of getting the vaccine.
It's very similar to an influenza vaccine going in to get one of those done. There are more questions, and that's just because of the virus. The vaccine is still relatively new, new to the public currently. This administration. This mechanism of action for the Pfizer and the Moderna vaccines is not terribly new. It's been around. It's been used in research on other viruses, but so you're going to have a lot more questions. It's about 8 to 9 questions depending on where you are to get it. Most of it has to do with have you had a severe allergic reaction to any other vaccines in the past?
Okay.
And that's in reference to some study data that showed that people that have had or are prone to having severe anaphylactic reactions to vaccines could have a similar reaction to this one. But it's more of that doesn't mean that you cannot get the vaccine. It just means that you should probably do it in a setting where you're going to have access to emergency measures in the event that you had an issue, but it doesn't preclude you from getting it.
Cool. And what's the timeline exactly on the vaccine of the first dose, second dose when you're, I guess, cleared?
It's the immune response is anywhere between 1 to 2 weeks after you get your second dose, but currently the efficacy of both of the Moderna and the Pfizer vaccines, after you take the first dose, you have about 50% immune response. And that just means you are 50% less likely to either catch COVID-19 or develop COVID-19 or and it's 50% effective at making it less severe. Okay. So 50% is, that's still better than a lot of the flu vaccines that we've had in the past years. But once you receive your second vaccine, the effectiveness bumps up to 95%.
Okay, wow, awesome response. Thank you so much. So you kind of touched on this in your last response, but I do want to ask you, for marginalized populations, notably the Black community, what are the implications of the infamous Tuskegee syphilis study?
Oh, huge. I mean, we see it across all aspects of what we do. COVID-related work, family planning-related work, it plays a huge part in our disparities. People are just reluctant to receive healthcare in minority communities in general. We go to the doctor when we need to go to the doctor, and typically that's the emergency room. And it's kind of too late sometimes at that point because we could have done some primary care, some preventative things early on. So we see a lot of that. And I think even with this, it's just, I don't want to be a guinea pig. I don't want a tracking device. You hear all those different messages that you hear from people in the community about the reason they don't want to be vaccinated. Or, I think sometimes, especially with our Black males, they have the Superman complex of, I'll be fine, the COVID is not real. Like even the disbelief that COVID, even though we're 10 months in, is not a real virus. And, people are dying every day. And I even see in our population, we minimize it. Oh, well, they had diabetes. It wasn't just COVID. They probably didn't even have a COVID. It's the rationalization of it's something other than what it is. So I think we have to get over our own fears, which I think a lot of that is the fear of healthcare, the fear of being another Tuskegee experiment multiplied by millions with the COVID vaccination.
Right. And so I did just want to give a few details because honestly, the Tuskegee study was something that was a little hazy for me as well. I had heard things and I wasn't quite sure what was true. So just so everyone knows, the Tuskegee syphilis study was a 1932 study that took place in Macon County, Alabama. 600 African American men were involved. 400 had some form of syphilis, and there were 200 as a control group without it. What actually happened was the men were not given syphilis. The men who had syphilis already had syphilis. What the thing was is that they were told they were being treated for syphilis and were not. And even when a treatment did come along, I believe it was penicillin, shown to cure syphilis, they were not given that by the people who were running the study. The study was originally designed to go 6 to 8 months, but continued for 40 years. So the implications on a similar application of that study in today would look like someone, I guess, receiving a vaccine for COVID-19 that was a placebo or something to that effect, but it would not be actually giving someone a virus or tracking devices or anything like that.
Like you said, with Tuskegee, individuals were not given an opportunity to make an informed choice. They were not given all the options and information available to them to make the best decisions for themselves. So when you come in to be vaccinated, you're receiving information on the vaccine. We give it out, I know, at our agency prior to you even getting there. So you already know what could potentially happen in terms of side effects, what's in the vaccine. And so you're aware of all those things before you come, so you can make the informed decision for you in terms of what's best for your health when you come in.
Okay. All right. Thank you so much for taking the time to be with us. I know you were super busy, especially during this pandemic. Please stay safe. And until next time, thank you so much for coming.
All right. Thank you so much for having me.
So thank you so much for your time, Adrian. Have a great day. It was great talking to you.
You too, Jordan.